So my name is Niels. I love wound healing, and honey is brilliant in healing wounds. So more than 4,000 years ago, the Egyptians already used honey for wound care. And the most well-known medical transcript from that time is from the Smith Papyrus, in which 48 wound care cases were described, all using honey. The discovery of antibiotics largely replaced the use of honey for wound care. However, there's a regained interest in honey because of the development of antibiotic resistance. The example.
We've known for several decades now that under natural conditions, microorganisms like to aggregate. That's what we call a biofilm. One of the key properties of biofilms in a biomedical context is that they are very difficult to eradicate.
This patient presented first with a mixed ulcer on the external part of the right foot. Very nice thing that you can see here, it is the biofilm.
Because of its slimy structure, the adherence to the wound bed, and as you can see, it's no bleeding or anything underneath.
The biofilms are our enemy.
One of the hallmarks of biofilm-related infections is that it actually requires very long treatments with, if possible, high doses of antimicrobial agents. The long-term use of antibiotics inevitably leads to the development of antimicrobial resistance. So we need alternatives. And what was surprising to me is to see that some of these medical-grade honeys were actually capable of eradicating microbial biofilms.
If there is any biofilm left, it's going to eliminate it, and also preventative. So we are going to avoid the formation of biofilm.
Different compounds, different ingredients of some of the formulations we tested seem to work synergistically, so seem to increase each other's activity. That was something I would not have predicted from the beginning.
It's antimicrobial activity. The antimicrobial activity of honey is based on multiple mechanisms. As you all know, honey consists of more than 200 different components, of which its relative majority being sugars. Sugar has a strong osmotic activity and can attract water from its surroundings. Like all organisms, microorganisms also need water to survive. So the osmotic activity of honey dehydrates bacteria, which damages them. In combination with hydrogen peroxide, which is being released in small amounts after glucose is broken down by the enzyme glucose oxidase, this will kill these bacteria. In addition, honey contains some phytochemicals that are considered antimicrobial molecules themselves. And lastly, the low pH of honey makes it hard for many microorganisms to persist. Moreover, what makes honey really interesting is that because of all these multiple mechanisms, it is also effective against multi-resistant bacteria and without the risk of developing resistance towards honey. But honey has also a broad spectrum antimicrobial activity, but it also can promote wound healing via different mechanisms. So it has strong anti-inflammatory properties and reduces redness and irritation. Honey promotes autolytic debridement and reduces malodor. Honey stimulates wound healing via multiple mechanisms, and it's proven to be a safe and cost-effective wound care treatment. But what kind of honey should we use for medical application, and what is medical-grade honey? To guarantee the quality, safety, and efficacy of medical-grade honey for medical application, medical-grade honey needs to follow stricter criteria than honey for food standards, such as those determined in the Honey Codex Alimentaris and those presented yesterday by Gina Klepper on the purity and authenticity of honey. And therefore, medical-grade honey needs to be free of pesticides, herbicides, heavy metals, and antibiotics. And this can be tested in a lab. Another important aspect is that medical-grade honey needs to be free of endospores, such as Clostridium botulinum, which has been associated with botulism. The only proven way to destroy these endospores is through gamma irradiation, Other conventional sterilization methods, such as heat, will also destroy the valuable enzymes such as glucose oxidase in honey that contribute to its bioactivity. So our Elmestron medical grade honey follows the aforementioned strict criteria and is clean and organic and also gamma sterilized. While it can be of different geographic origins and floral sources, which also secures the supply chain of affordable honeys. So our medical grade honey-based wound care formulations do not contain pure honey, as pure honey formulation can also cause pain when applied to a wound. The addition of other ingredients will also help the applicability and further improve the wonderful effects of honey. So Elmestron contains 40% medical grade honey, several supplements to make it a cream, and vitamins C and E, potentiating the effect of medical grade honey. This synergistic activity has been reported in multiple publications. In one of these studies, the anti-biofilm activity of different products was compared. In the first experiment, the antimicrobial activity of Manuka honey was compared with Elmestron soft. This demonstrated that Elmestron was much more effective than Manuka. Therefore, in the next experiment, the different components of Elmestron were analyzed separately. The raw honey component was less effective, and also the vitamin C and E, and the formulation without the honey were less effective. Together, demonstrating that there is a synergistic activity going on in our wound care formulation. In conclusion, medical grade honey-based wound care formulations can be further improved by adding the right supplements. This ends my presentation, and I would like to thank you for your attention.